Hello, everyone, and welcome to today's webinar, No Ifs, Ands, or Buts, All Things Colon Cancer. I'm Beth Battaglino, CEO of Healthy Women, and I am pleased to be joined by three outstanding guests today who are helping us learn more about this cancer that affects as many as 1 in 25 women in their lifetime. Our goal today is to help better understand the disease and dive into the risks, factors, and learn how regular screenings can help in early detection. I want to thank our partner, Fight Colorectal Cancer, for working with us on this outstanding program. And I would also like to thank Merck for their continued support. Now let's begin. I'd first like to introduce Dr. Fola May. Dr. May is an associate professor of medicine at the University of California, Los Angeles, and a gastroenterologist in the Veteran Affairs healthcare system. As the Director of Quality Improvement in Gastroenterology for UCLA Health and the Director of the May Lab at UCLA Health, she works to improve cancer prevention and care overall and within underserved populations. Dr. Sarah Slater is an instructor of medicine at the Harvard Medical School and a medical oncologist in the Gastrointestinal Cancer Center at the Dana-Farber Cancer Institute. She specializes in the care of patients with gastrointestinal cancers, including colorectal, pancreatic, gastroesophageal, and neuroendocrine tumors. And Carole Motycka is a stage 4 colon cancer and living donor liver transplant survivor. Carole was diagnosed with stage 4 colon cancer in 2016 at the age of 42. A mom of 4, she currently resides in Connecticut and is the patient education coordinator for Fight Colorectal Cancer. Welcome, everyone, and thank you for being here today. So, Dr. May, I'm going to kick off our conversation today with you. First, where is the colon and how is colon cancer defined?
First of all, thank you very much for having me, and thank you for covering this very important topic. A lot of people don't know where the colon is. The colon is an organ that is part of your digestive system. Your digestive system actually starts in your mouth and goes all the way down to your bottom, and your colon is at the end part of that system. It's a large organ. It's about 5 to 6 feet long. And really, the goal of the colon is to absorb water that we need for our nutritional balance, and also to concentrate stool and store that stool until we are ready to pass it into the toilet bowl. So it really is an organ that's there just to help us with the end part of our digestive system. But unfortunately, it can get us into trouble because it is an organ that is where we are commonly developing cancers.
Thank you. And Dr. Slater, when we think about cancer and cancer diagnosis, we automatically go to, were there any symptoms? Do most people have symptoms before they're diagnosed with colon cancer?
Oh, yes. So these are good questions. And thank you again for inviting me and for addressing some of these issues. So there are different types of symptoms that people can present with when they have colorectal cancer. One of the most common symptoms would be blood in the stool or rectal bleeding, which is something that we encourage patients to look out for and definitely bring to a doctor's attention. Other symptoms that we can see would be pain, cramping, a change in bowel habits, so either diarrhea or constipation, sometimes a change in the consistency of stools, or a feeling like you're not fully able to evacuate or have a full bowel movement. And then other sort of more general symptoms like fatigue or weight loss. All of those can be a sign that something may be going on in the lower GI tract that we should check out.
Thank you for sharing that. And Carole, can you share your story? What symptoms did you have and what made you make that appointment to see your doctor?
Sure. Thank you for having me, first of all. My symptoms were quite unique as I'm young and I was in the prime of my health. So a lot of the symptoms that we speak of and I speak of in my profession weren't symptoms that I actually was presented with. Probably looking back, as a woman, a lot of the typical symptoms that we experience, I pushed aside to being a busy mom, being on the go, different things that were happening within that space. But I actually presented one day when I was on a hike. I had been on a 20-mile hike, and I thought that I had slipped and I had some shoulder pain, and I had made a trip to the ER because it was that severe. And that shoulder pain actually led to my physicians in the ER being very good investigators, and they explored what was going on. And I had some liver enzymes, a blood panel run, and it actually showed that there were some issues. And as we investigated more, we discovered the tumors that were on my liver, and then we actually, through a CT scan, discovered that there was a large tumor in my colon. So mine presented in a little bit different space, but certainly looking back, I did have a lot of the traditional symptoms, just didn't realize those. I just kind of pushed them onto being a busy, active woman and a busy mom. And so, yeah, those are certainly things that we want to promote, not putting those aside and making sure
Right.
that we ask those questions.
No, I think it's so important. And thank you so much for sharing your story. So Dr. May and Dr. Slater, for colon cancer, who's at risk? Dr. Slater, you want to take, who's at risk?
I think as we get older, our chances of colon cancer increase. So older adults are at higher risk. And there's a slightly higher predominance in men compared to women, although it's very common in both sexes. We actually see higher rates of colon cancer in Black Americans as well. And when I think we touch on this a little bit later, but patients or families that have genetic syndromes that predispose them to cancer are also at higher risk. Dr. May, I'm not sure if you want to add to that.
Yeah.
I mean, I agree. Oh, I'm sorry, Beth, were you gonna
No,
say
I
something?
was just going to say, Dr. May, please jump in, because I would love to, if we're hearing so much about IBS and Crohn's disease, does that put you more at risk for potentially developing colon cancer?
Absolutely. I'm happy to address that. And I actually agree completely with Dr. Slater and what she said. And I like to remind people that everyone's at risk for this disease, because I think there's this misconception that this is a disease of older people or of men, and that's just false. We're seeing colorectal cancer in younger and younger people. Unfortunately, we're seeing it in people in their 40s and their 50s, unfortunately, as Carole has shared. And we see it in women almost as much as we see it in men. So that's a misconception that's out there in the public. It's the number 2 cancer killer. So we are all at risk. You are right that there are some conditions that predispose us to this disease. So you mentioned IBD, which is inflammatory bowel disease. This includes ulcerative colitis and Crohn's disease. These are conditions that you would know if you had. And if you have them, yes, you do have a higher risk of developing colorectal cancer in a lifetime, which is a little bit different than IBS, which is irritable bowel syndrome. That does not increase your risk of getting colorectal cancer.
Great. Thank you so much for sharing that. And I'm going to go into screening recommendations for colon cancer. Dr. Slater, what would you recommend as far from an oncology perspective? How often should people get screened for colon cancer?
Well, in the recent past, the guidelines have changed a little bit. And so we're actually recommending that people start colon cancer screening earlier, so at age 45. And it may be even earlier than that if you have a family history of colon cancer. So usually we recommend, if you have a first-degree relative, getting screened 10 years earlier than their diagnosis. And also if you have one of these genetic syndromes that predisposes you to colon cancer or other types of cancer, the screening is variable, but tends to be a little bit more frequent and earlier than we would for the general population.
And so many people are not fans of getting screened. They are not so much afraid of the actual screening process, but the preparation beforehand. Why is screening important, and is the prep process improving? Dr. Slater?
I feel like
Or
Dr. May.
Dr. May, I'm sorry. Yep, Dr. May, go ahead. Grab
I'm
it.
sure Dr. Slater can answer this question as well, because I'm sure she agrees with me on the importance of screening. And
Sure.
you're right, there's really this massive stigma about the colon, about the rectum, even using words like rectum. And unfortunately, it's contributing to people not getting screened and really risking their lives. There are very few cancers in the world that we can prevent with screening, and colorectal cancer is one of them, meaning that there are tests that you can participate in that are making it less likely for you to have a colorectal cancer diagnosis, or also helping us catch it early enough that you can be cured. So screening is super effective, particularly for this cancer. The most common type of screening, as you've alluded to, is the colonoscopy. This is the concept of seeing usually a gastroenterologist like myself in a medical facility. We do use a sedation medication to put you to sleep, and we use a tool to inspect the colon through your rectum while you are asleep. No one likes the idea of being instrumented through their bottom, and no one likes the day before this procedure because you have to take a laxative to clear yourself of all your stool. Now, I like to remind people that people very happily pay for colon cleanses all the time, and we're giving you one for free in this case. But it's necessary to do that prep or the laxative cleanse for your colon to be completely empty and clear so that we can look along the linings of the colon for polyps and early cancers. So really our goal as prevention experts is to try to convince people that even though there's this ick factor and this stigma, screening is effective. It can help save your life, and you definitely need to start when you're age 45 or even earlier than that if you have a family history.
I think that's so important, and thank you so much for talking us through the process. So again, age 45 and younger, if you have a family history, you should be screened. So important. Dr. May, I also wanted to ask you about at-home screening options. So what can you talk us through some of the options that are now available in regards to screening at home versus going in for a colonoscopy?
I'm so happy you asked about this because there are some patients that hear about the colonoscopy and they're just not excited about having the procedure, the prep. Some people can't get a day off of work to get a colonoscopy. So we're very lucky with this disease that we have many options for screening. And the United States Preventive Service Task Force, which really is the governing body that makes a lot of our guidelines around preventive services, has deemed about 6 different strategies that you can participate in for colorectal cancer screening. 2 of these are very common. One is called the fecal immunochemical test, or the FIT kit, and the other is called Cologuard, which is a test that is provided by Exact Sciences. These are studies or tests that you can do in the comfort of your own home. So your doctor can write you a prescription for these tests. The kit actually arrives to your home, or you can get it from your doctor's office. It comes with careful instructions on how you can very cleanly and in a hygienic way collect a small sample of your stool. You package that up in the packaging that they give you, and you mail that off to a lab. And at the lab, they can study that sample for early signs of colon or rectal cancer. So a lot of people are opting for these tests. They're very effective. You do have to do them every 1 to 3 years. So it's more frequent than a colonoscopy, which can be as infrequent as every 10 years. But I always tell people that the best test is the test that gets done. So pick the test that's best for you.
Oh, I love that. So smart. Such a smart way of 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 um, really communicating how important that getting screened and testing is. Thank you for that. So now we've done the test. What happens if there's a positive result via the home screening test, Dr. May?
Yeah. So the one thing that's very important to note about these convenient at-home screening tests are that they are a 2-step process. So what do I mean by that? I mean that if you do that test at home and your doctor calls you to tell you that you had an abnormal result or a positive result, you do need to complete the second step. And the second step of screening in this case is the colonoscopy, because that's the only way that we can tell you why that test was abnormal, why it showed up as positive. So it is very important for our primary care doctors to communicate with our patients, to get those patients in to see a gastroenterologist or another specialist who can do that colonoscopy as soon as possible if your at-home screening test turns up abnormal.
Great. And Dr. Slater, if diagnosed with cancer, what are the treatment options right now for
Yeah,
patients?
so a lot depends on what we call the stage of the cancer. So how much cancer is present. So if Dr. May found a tumor in the colon, she would biopsy it, and then we would review the pathology. And usually at that point, we would do a CT scan, and that would look to see if there's cancer elsewhere in the body. Based on that assessment, we would make a determination about what the best treatment would be. So for patients who have early stage colon cancer, so cancer that hasn't spread outside of the region, so colon cancer that is in the colon or in the lymph nodes around the colon, we would generally recommend surgical resection if possible. That may be followed by chemotherapy in order to try to decrease the risk of recurrence. If the cancer has already spread to other parts of the body, then usually we're starting with chemotherapy, and that may be augmented by surgery or liver-directed options, as Carole may comment on. So there are lots of treatment options that are available for colon cancer. And I think the important thing is that if we identify cancer early, we have more and better options, and we have curative options. And so I think we always want to stress that the reason we're encouraging people to get screened is because we can reduce the risk of death from colon cancer by doing appropriate screening in on a population basis.
So all of you that are listening today, make sure screening is important and it saves lives. Early detection is super important, and there are more treatment options available if diagnosed with colon cancer. So thank you so much, Dr. May and Dr. Slater, for sharing information on that. Carole, I'm going to go to you now. As with most cancer diagnosis, a colon cancer diagnosis can affect your mental health. What advice do you have from a person who has received a positive cancer diagnosis or currently going through treatment? What helped you?
Great question. I want to take a second and step back and address Dr. Slater. You made some really great points about screening guidelines, and I'm so thankful that you made those points clear, because the strategy is what we can do is make sure that those points are made. And I also wanted to point out that there is a bit of confusion, right, when it looks like the genetic history and what does that look like, and just wanted to point out, my cancer is a genetic cancer. And so I'm an advocate for the genetic cancer space. My son was 19 when I was diagnosed at 42, and he had 3 precancerous polyps at 19 years old. And so those guidelines, while they're so important and so valuable, we also need to make sure that we ask questions when we're in that genetic space, because we don't know what that looks like. I think we're still learning. And so, knowledge is power. And so, one of the things that I did for my own mental health, is I made sure that I asked those questions, because the guidelines are important, but we still need to empower ourselves with knowing that we can prevent this cancer, for our families. And so, I would also, make sure that that's a point that we share. And Dr. Fola May, I know the importance of, those colonoscopies, right? I have a cancer that is completely preventable. And my husband died of a cancer that's completely preventable through colonoscopy and early detection. And so for me, I would always tell anybody that is wondering about having that first colonoscopy or having that FIT test or, wanting to go through that, I would say, listen, I've had 19 surgeries, and I've had my colon removed, and I've had my appendix removed, and I've had, all of the important or the non-essential organs, they're all gone, and I have a new liver. And so to go through all of those things in the mental health space, the colonoscopy seems really a no-brainer. It's just an easy win for us, all of us, because we have that tool. And going back to, preventing this, we can prevent this cancer. And so we don't have to have any more deaths. And so, going through it, when I was diagnosed in 2016, for my mental health, I had to go through the acute care. I had to make sure that I healed myself and that I learned and listened and engaged and understood in what it looked like for my family to face cancer, for my children, what it looked like for them, for their futures, so that I could make sure that they didn't ever have to have a cancer in their life besides what their mom was going through. And so in 2018, after I went through my acute care and my liver transplant, I felt a push to be engaged. I felt a push to do better or to make change, because I wanted to know that what I'd been through and the really sad, hard, ugly part of cancer, I could use and turn into a positive to project and save and make a difference and change the trajectory of someone else's life. And so for me, in that mental health space, I could advocate, right? And I could stand up and I could use my voice to affect positive change. And so that's what I chose to do. I think, we really have to sit back and we have to say, it's okay to feel bad. It's okay to be sad. And it's okay to also feel empowered. And so I used all those tools to project positive, even through this really hard thing that is cancer, just to hopefully shine light for somebody else. So in my mental health space, that's what that looked like for me. And so now I use my story and what I do, to hopefully, affect change in a bigger space, but also encourage people that you're never alone, that we're all here. This is a really big, comforting blanket of community that exists within colorectal cancer. And we're here to stand beside you and stand together with you and allow you to come to us. And, we're here to provide you resources and to provide you love and comfort, even through the hard days, because they're definitely hard days. But the community of champions within Fight Colorectal Cancer, we exist. We exist to empower people and to help them along their journey. So that's what I do for my mental health.
Oh, Carole, it's unbelievable. And you are doing such great things for so many people. So thank you so much for sharing your story and for paying it forward. What a great gift you are. Dr. May, Dr. Slater, and Carole, thank you so much for your time today. And this has been an outstanding conversation. Thank you all so much for being with us today, and for our partner, Fight Colorectal Cancer, and to Merck for making this webinar possible. Our goal at Healthy Women is that no woman feels alone in her health journey, and I hope we were able to give women the information necessary to best navigate the prevention and treatment of colon cancer. For more information on colon cancer, visit healthywomen.org and fightcolorectalcancer.org. For all other women's health needs, please continue to visit our website at healthywomen.org. Thank you.